And joining us now is Dr. Sanjay Gupta. Needs no introduction past that.
Dr. Gupta, here to break down the facts on COVID-19.
Is there one red flag, something you're experiencing at home that says, okay, time to get to the hospital, get to the doctor, and get the real care?
One of the red flags, and again, I want to be a little humble here because, we're learning about this all together, really real time. I mean, a lot of times when I've spoken to you in the past and I'm telling you things, it's based on 20 years of data, right? I can really feel confident.
Sure.
We haven't even had 3 months. This is a brand new thing. But having said that, one of the things I think is a bit of a red flag is, let's say you're not feeling well, then you start to feel better, and then all of a sudden the symptoms come back. That coming back part is of concern. Obviously, if you have sudden worsening of symptoms, difficulty breathing, spiking a high fever, things like that are more serious symptoms. But if you start to develop this sort of crescendo effect, that's worth talking to your doctor about. We know that the most vulnerable people are people who are elderly, typically in their 70s or 80s, although they define elderly as 60 and above. It's really people in their 70s and 80s who are most affected by this. And people who really have 4 underlying health conditions, which are heart disease, diabetes, hypertension, and lung disease. Those are the people we got to help protect.
Most importantly is most people who get this are going to recover. So there's a lot of emphasis on the corona test, but something tells me that, if you're a healthy person, you don't need a test.
This virus, the coronavirus, the new one, tends to affect the lower part of your respiratory system, more so than the upper part of your respiratory system. So what does that mean? It means that things like shortness of breath might be an earlier symptom. But on the other hand, if you have a runny nose, that makes it less likely to be coronavirus. Most people, if they do get exposed to this virus, are going to have a few bad days, a few days of being miserable, and they're going to recover.
Dr. Gupta is taking on all these topics in his podcast, Coronavirus Fact versus Fiction. And he told me, although protection and preparation are important, we all need to just calm down.
A lot of people are sharing this idea that fear spreads faster than virus, which I think is really actually great and helpful. What can you tell us right now to suppress fear if it might be rising up in some people?
Yeah, first of all, you're absolutely right. I mean, I think the movie Contagion, the through line on that was sometimes fear and misinformation travel faster than the virus and are more destructive than the virus itself. You hear the word pandemic and it sounds a lot like panic, and so that's what people do. Even back not that long ago, our last pandemic, H1N1, we were able to get through that, with basic strategies. We're asking people to change their behavior, not be as close to each other, not shake hands. These may sound like silly things, washing your hands and doing it really, really well, because you, as a healthy person, now have an obligation to the people around you.
Thank you for watching. If you want more extra, hit the subscribe button and the bell so you'll never miss a video.